Welcome to Conundrum Investment Sperms and Drums. I am Conundrum. On today's episode, we are going to discuss the hidden gem known as Vericel, and also known as VCell for the stock ticker. VCell sells two products, MACI and Epicel. MACI uses a patient's own cells that have been expanded and placed onto film that is implanted into an area of the knee where a damaged cartilage has been removed. From there, MACI may be absorbed back into the patient's own tissue. The basis of this third-generation tech has been used over 20 years to provide long-lasting pain relief that help patients regain knee function.
Immediately after the surgery, there's some swelling that is unavoidable, and that was really painful. But it's a different type of pain, and it went away pretty quickly. The pain from my cartilage damage was gone. It was like a whole new me. It was already better than before the surgery when I was still mid-recovery.
MACI has the ability to revolutionize the healthcare field when compared to the other knee repair options offered by surgeons, such as chondroplasty, which provides temporary relief after a surgeon trims the damaged knee cartilage, then rinse with sterile water. A third option that may be offered by surgeons, known as osteochondral implants, is limited in the ability of obtaining donor tissue from a cadaver or the patient's own tissue. Healthy pieces of bone and cartilage are plugged into damaged areas. The last option is total knee replacement, where a metal shell replaces the end of the femur bone, while a channeled plastic piece with a metal stem replaces the top end of the tibia bone. The underside of a kneecap may also be fitted with a plastic button depending on its condition. Extensive physical therapy is needed afterward. This option is the most invasive. It is estimated that in the United States that over 600,000 total knee replacements are carried out annually. The second product is Epicel, where 2 postage stamp size biopsies from a patient can be used to grow enough skin to cover their entire body. You're probably asking yourself, why would this technology be useful? Well, these grafts are used for burn victims who suffer deep dermal or full thickness burns that covers 30% or more of their body surface area. As seen in the chart, different body parts make up different percentages. Burn victims with burns that cover 30% or more of their body surface areas are at higher risk of dehydration, infections, and death. About 4,500 people die from burns annually in the United States. Up to 10,000 people die from related burn infections, and about 1.1 million burn injuries require medical interventions.
I try to reserve the use of cultured cells for the anterior surfaces, the arms, because we can immobilize the arms well, circumferentially. But typically that's what I want. So ideally, if I've got a 60-70% total body surface area burn patient, I will have skin grafted their back and the back of their legs with their own skin, and then use CEA for the anterior surfaces. We've shown that, and others have shown that the take rate is much better.
As reported on the Vericel website, the overall survival rate in their clinical trials were 84.4% at hospital discharge. Pediatric patients' survival rate was higher at 88.9%, while adults were at 82%. The 2 cutscenes presented in today's presentation are just small clips of larger videos that may be found on the Vericel website. We highly advise that you take the time out to look at them in their entirety in order to understand these 2 products' limitations and full applications. I have to admit, I own 100 shares of VCell that was purchased at an average of $17.13 per share for a total of $1,713. Today each share is worth $42.51 for a grand total of $4,251. That's 148.22% profit. I do plan on adding more shares on the dips. Hey Harry the Bear.
Hey sperms and bulls, due to the pandemic, certain hospitals are limiting elective procedures such as knee cartilage repairs. Plus, not everyone who fits into the knee cartilage repair or skin grafting category knows about these 2 options. It will take years for the VCell technologies to become the new standard of care for burn victims or people suffering from chronic knee pain. Remember, sperms and drums, to do your own research.
Okay. Bye Felicia. Hey everyone, is Junior the Bull.
Hey sperms and bulls, VCell has beaten their 4th quarter expectations even though COVID-19 made things difficult for elective surgeries. The company ended 2020 with $100 million in cash and investments with no debt. Epicel and MACI use in the medical field is continuing to grow. Remember, bull stonks only go up.
Lay off the Red Bull, Junior. What do y'all think about VCell, and would you think about investing in this company? Please, sperms and drums, don't forget to hit like and subscribe if you want to see other new stocks that have amazing growth potential. Until next time, remember, secure the bag.